Okay, well, it's 1 o'clock and I'd like to welcome everybody to Mindful Philanthropy's Funder Salon, empowering youth to advance policy solutions for school mental health. For those of you who don't know me, I'm Barbara Ricci, the Executive Director of Mindful Philanthropy, and we are a 1-year-old nonprofit organization whose sole mission is to increase the amount of new and impactful funding for mental health, addiction, and community well-being initiatives. And one of the ways we support donors is by providing free resources like today's event. And in response to donor interest, we have hosted funder salons on, for example, how philanthropy can support the mental health and well-being of young people of color as they confront racial trauma. We hosted a session on innovative services research for mood disorders like depression and bipolar, and another on how philanthropy can support women experiencing addiction. You can access these webinars plus more on our website. Today, you will meet 4 exceptional nonprofit leaders who empower youth to advocate for mental health policy change at the local, state, and federal level. And the work that they are doing is really a once-in-a-lifetime opportunity to shape a comprehensive approach to mental health in the schools as a result of the American Rescue Plan dropping $123 billion into K through 12 schools in response to COVID. So it's so important what Mental Health America, Inseparable, and the Center for Law and Social Policy are doing to support youth voices, because we all know that when you work with legislators, having metrics, having quantitative data is great, but it's really the personal story, it's the case study, it's having them understand the concepts behind why we need the policies we need that make a difference. So I'm really grateful that these exemplary organizations are doing this work with young people. And I hope that you really feel inspired to support the organizations and others that we will highlight after the call. So in terms of process, today I'll be moderating a panel discussion and we will have audience Q&A at the end. Feel free to post questions or comments in the group chat at any time. We will get to them. You can also privately chat Kristen Ward, our Director of Programs and Knowledge, and she's just going to pop into the chat and say hi so you see her name and spelling. So let's start the program by welcoming our panelists. I'm delighted to introduce Mary Giliberti, Executive Vice President of Policy at Mental Health America, William Antoine McClain Jr., founder of William McClain Youth Platform, and a member of Mindful Philanthropy's 2021 Summer Intern Cohort. Bill Smith, founding partner of Civitas Public Affairs Group and the founder of Inseparable, and Dr. Nia West-Bey, the Director of Youth Policy at the Center for Law and Social Policy, and also a Mindful Philanthropy Advisory Board member. So welcome everybody. And I like to start with asking everybody, what is your why? So if we could go around the room and just say, why are you doing this work? And we'll kick it off with you, Mary.
Sure. So as you'll hear, I am very passionate about mental health education, and that's in part because I didn't have any. So when I went to elementary, middle, high school, I didn't get any mental health education. And then when I got to college, I became good friends and ultimately shared a suite of rooms with someone who had major depression. And I said everything that Mental Health America and every organization here would tell you not to say. Cheer up, look at the bright side. All these things that I didn't know were telling her every day that I didn't understand what she was going through and were not at all supportive or helpful. And in my senior year, she attempted suicide. And in my after we graduated, my friend canceled a trip to visit with me. And then I got the news that she had died by suicide. And so for me, this is very personal and something that I think every student in America should understand so that they can be a supportive friend and they can help someone access the help that they need.
Thanks, Mary. That's really powerful. Will, how about you? What brings you to this work?
Definitely. In my experience on the ground, I've definitely noticed that mental health, it has become one of the top concerns for all Americans, especially young adults in our school systems. And many times we're not aware, we're not receiving education about mental health in our spaces and access to care. And as we continue to progress forward as a society, we must make sure that there's knowledge going on and awareness about mental health, so we can make sure that everyone are productive, efficient citizens that provide to society. Mental health is a top concern for everyone, and we must take it as such. That's my why.
Thanks, Will. Bill, how about you?
Of course, I'm going to be that guy who was on mute. You know, like far too many people, and like Mary, I come to this work because of loss. I am the youngest of three brothers and lost my middle brother to suicide 3 years ago this month, after a really long struggle of trying to get him access to the right kind of care. And, you know, his loss devastated our family, as it has far too many families. And I worked with others to set up Inseparable last year as a way to use my professional advocacy background for an effort that really is always going to be a part of my heart.
I'm sorry for your loss, Bill. That's devastating. Nia, how about you? What brings you to this work?
Thanks, Barbara, and thanks to everybody else for sharing. You know, I think one of the things that's obviously already coming through here is that we're all impacted by mental health. That's something that everybody experiences. And I think, you know, at class, we're focused on an array of issues that impact the lives of people with low incomes and folks who are living in poverty in this country. And I've had the opportunity through my work to talk to young people all around the country, and whether they're in rural Kentucky or in urban Hawaii or in, you know, Baltimore or Texas or California, across the board, we're hearing from young people that mental health is a priority, and that they're not getting access to the resources that they need and deserve. And this was true well before we hit the pandemic, but I think what's particularly important as we go into this conversation, I know Mary's going to share more about this, is that the pandemic took what was already a bad situation, both in terms of the level of need, as well as particularly the level of unmet need, and made it exponentially worse. And so I think this is a really important moment to not lose the opportunity to make some really critical investments in young people's mental health, and sort of start to tackle what is really a decades-long problem, and take advantage of this moment to really try and do something different for young people, because that's what they're calling for and that's what they're demanding.
Yeah, absolutely, Nia. Thank you for that. Things are moving fast and hard. There's a lot of money coming, but it needs to be put to work in the right ways. And there's such an important role that all of you play in that. So building upon what you said, Nia, Mary, Mental Health America has an anonymous and free online screening tool for people to understand and make decisions about their mental health. And almost 3,000 screens are taken every day, and over 5 million people have completed the Mental Health America screen since its launch. You know, what are you observing in the data? What are you hearing from your Young Mental Health Leaders Council in terms of just the general case, like why it's so important we're working with the schools?
Yeah, I think we're hearing and seeing two complementary themes. One is that mental health is worsening. It began prior to COVID and is accelerated during COVID. And at the same time, we're seeing the resilience and the leadership emerge in youth. I mean, this is, as others have said, a really important issue to them. And that's really what we're hearing overall. With respect to our online screening program, so you can come to our website and you can take a screen in any mental health condition, anxiety, depression, psychosis, you name it. And what we saw during COVID, during 2020, was an amazing increase in young people, 11 to 17, coming to the website. They used to make up about 29% of our screens. Now they're up to 42%. And we had nearly 1 million 11 to 17-year-olds take that screen. That age group is most likely to screen moderate to severe for anxiety and depression. And the suicide numbers were particularly concerning. Roughly half of the screeners for depression having persistent thoughts of suicide, LGBTQ youth, 62% of the screeners for depression having persistent thoughts of suicide. And we're continuing to see disparities based on race and ethnicity that, again, as Nia mentioned, we saw prior to the pandemic, but have been accelerated during the pandemic. And that data is confirmed by what CDC is seeing, increases in hospitalizations from 2019 to 2020, 31% for older teens and 24% for 5 to 11-year-olds. Those are really significant changes showing declining mental health and a public health crisis that really needs an immediate response.
Thank you for setting the stage on why we're so focused on this as a sector and at Mindful Philanthropy. Bill, can you now shift over to what is the policy need here? What is, tell us a little bit about Inseparable and why you're focusing on schools. You're that guy again, Bill.
Let Allison mute me. But Nia and Mary both really highlighted the data that were sort of screaming to us that we've got to focus in on young people. And the good news that you can make huge differences with investments in prevention and early intervention, and schools are really the prime environment to do that. Because if you think about half of mental illness presents before age 14, and we know that every kid in America has to go to school, and we know that children are more likely to receive mental health care in school than any other setting. So when you think about that, and especially the access gap for some specific populations that Mary mentioned, like LGBTQ kids and children of color, having a comprehensive approach in schools is the way we get to these kids. So we're pushing to proactively put systems in place in schools from kindergarten through 12th grade. And a big part of that is going to be mobilizing youth to advocate for these changes, because as Nia said, they get it. And they know what they need. And so what we need to do is give them the tools to advocate and create that change.
Thanks, Bill. And Nia, your organization has been doing this for 50 years. I mean, the Center for Law and Social Policy has been lifting up the voices of young people and equipping them to advocate, especially for people and families with low incomes. So what have you learned in terms of supporting youth, and what are you trying to do here at this really critical moment in time?
Great question, Barbara. And, I think it's really important to note that even though CLASP is 50 years old and the youth policy team is knocking on 20 years old, historically, policy organizations have done very little, including the voices of the people who are most impacted by some of the policies that we advocate for, right? So one of the best things about my time at CLASP, because I'm a youth worker in my heart of hearts, has really been figuring out how we can bring young people into national policy conversations to have their voices and their influence centered, because it's actually something that is shockingly uncommon in policy spaces. So there's been some really intentional work on my team over the last 5 years to do what we started out calling our young adult engagement strategy, which was really sort of a concerted effort to figure out exactly that, right? What does it look like for young people to be in national policy spaces, to be involved in those conversations, to be leading those conversations? And that work has evolved over the last few years to the point where we've now been working on an initiative since last fall called A New Deal for Youth, where we're working with almost 40 young leaders from around the country. William is one of them, so I look forward to you all being able to hear a little more from him. That are working together to build out an intersectional, holistic policy agenda across 6 issue areas that young people identified. And unsurprisingly, one of the big issues that young people identified was healing and well-being. So we've really gone through a process with the young leaders that we're working with over the last almost 9 months now, where we both were figuring out who are we as a group, what are we about, how do we want to work together, how do we want to be with each other, but that it's also been about figuring out, okay, what is the change that we want to see, what are our demands? What are we asking for? And we just rolled out just about a month ago now, our demands publicly. Folks can go to a New Deal for Youth, all spelled out.org, and check out our demands both in healing and well-being and across the other 5 issue areas that the group has been working on. But I will note that the sort of subgroup that has been working on healing and well-being is the largest group. I think we've got a quarter of the group that has been involved in that piece. And the other thing that's been really interesting is that the mental health pieces and the healing and well-being pieces are coming out in other areas of the agenda. So it shows up in environmental justice. It shows up in immigration justice. It shows up in economic justice. To young people, mental health is really tied to all of these other issues, and you can't really meet their economic needs if you're not addressing mental health. You can't effectively, deal with climate change in the environment if we're not thinking about mental health. You can't address what's going on the border in this country or the issues of undocumented young people or DACA recipients if you're not thinking about mental health. So this is really a core issue to young people across so many different areas. And if you listen, they have answers. They have ideas for what needs to be different and how it needs to be different. And they don't have a lot of patience. So I really appreciate the ways that the young leaders that we're working with are pushing us to move aggressively, but thoughtfully, to really do something different in terms of young people's mental health.
Yeah, Gen Z really has fire in their belly to activate change, and I'm glad they have that sense of urgency. It's very needed right now. Will, so you've been involved with CLASP, a New Deal for Youth. You started your own political action committee. You're serving on the Mental Health National Advisory Board. What are you seeing on the ground?
I'm gonna recall back one event where I had for the political action committee. I invited a young man to receive a scholarship, and he ended up coming at the beginning of that event. And by the end of the event, we talked about local and state ordinances and bills that were previously passed through the Georgia General Assembly, and it caught his attention. And it wasn't just because it was politics or bills, but it was because it was relatable to him. The way that it was presented, we made it relatable to young individuals. Whenever you can easily post something or put things out there, but when it's not catered to somebody, they're not going to pay attention to it because it doesn't affect them. So once you find a way to deliver it to them and make it relatable to them and affect them in some type of way, then they're going to pay attention to it. And if there's an issue, they're going to want to be a part of the solution to solve that problem. For example, mental health. We may not talk about it that much. It may not be taught as much in my community specifically, I can speak on personally, which causes issues down the road, such as going out for that help, going out to get that access to care. And that ended up causes us down the road to fall into those issues of where, like I said, we're not having that mental health access. We were not having that access to mental health care. And that's exactly where we're at with that. So I'll definitely just leave it there. But that's exactly what we're seeing on the ground. Like I said, once you make it relatable to them, they're going to want to be engaged. They're going to want to be a part of the solution. And then, like you'll see, boards like the New Deal for Youth, Mental Health National Advisory Board, you'll see people that want to be a part of it and collaborate with others from different backgrounds, different perspectives, regardless of age, gender, socioeconomic status. So they'll come together collaboratively. That's what I'm seeing on the ground.
Oh, that's so great to hear. Mary and I have had this conversation for years that youth can be so powerful, but they need to know how to tell their story in the right way. They need to know who to tell it to and when to tell it to really be effective. And that's why, what Inseparable and CLASP and MHA are doing is they're supporting youth to do that, to send out these armies at the state capitals, at the local level to do that. So very exciting. Mary, back to you. Thanks to the generous support of one of Mindful Philanthropy's clients, you were able to do a deep dive analysis on state mental health policy. And you're going to have this first of a kind report come out in July. I expect it's going to attract a lot of national attention. Can you give us some early looks as to what your school-based mental health policy report is going to show?
Absolutely, Barbara. So States are like our laboratories for policy, and that's really what we found here. We found some really interesting initiatives in states, but no state really had a full complement of policy. So there's lots of work to be done at the state level, and then also in building out a national strategy with youth voices, led by youth voices. And through the work that we saw at the state level, incredible youth leadership, which I'll highlight as I go through some of the areas that the report will focus on. So we're focusing on 3 major buckets of mental health policy. The first is mental health education in schools. So, do we have, and very few states have, K through 12 mental health education? And we put a spotlight on New York, which enacted the first piece of legislation to do that. And youth voices were critical in getting that over the line. They told their stories when legislators just weren't paying attention to get that bill over the line. And implementation is also very important. There's a technical assistance center in New York that's making sure that the promise of the law is fulfilled, because that we really learned through our work. Getting a law passed is only the first stage of the work. So we highlighted the number of states that have had this kind of legislation and others that have more regulations that don't have much teeth, and there's more work to be done. The second bucket is mental health services in schools. And there's a lot to unpack there, so I'm going to stay at a high level. But that has to do with services actually at the schools. Issues like what's the ratios of school mental health professionals to students. Issues like Medicaid coverage. How expansive is Medicaid in covering mental health services in schools? Only 14 states have taken advantage of the flexibility to use that in a maximal way. So there's, again, a lot of work to be done. Telehealth. A little more than half the states have very clear telehealth policies with Medicaid. So what's going on in the other states? Because telehealth has been really a wonderful way to expand access. And Texas, in particular, not a state you might think, has a really expansive program on telehealth and mental health in schools, consultation programs that provide a lot of assistance in that state. And then we have the issue of community providers coming into schools. And I want to highlight this one because I think it really has had a major impact on the disparities that we talked about early in this conversation in access to care. So what we're seeing is that when students get services right in the school building through community providers coming in, students that were never served before get access, and disproportionately, those are students of color. So these are important policies to consider as we think about equity going forward. So there's lots of different kinds of policies that really improve mental health services in schools for us to work on, and getting these community providers at the school setting, getting rid of all the barriers to transportation, making an appointment, all those kinds of things, insurance, what kind of insurance you have, those barriers go away, and that's really important. The last category is supports for students, and that has to do with sick days and making sure you can take them for mental health as well as physical health reasons. And youth have been tremendous leaders in this area. In every state where this is passed, youth have been leading the way, bringing the bills forward, writing the legislation, testifying about it, really doing incredible work to bring that forward. So those are the buckets, and I think that that is beginning to put together a lot of interesting ideas that need to be put together into a national strategy. So we need to see things happening at the local, state, and national levels.
Very exciting. I can't wait to see that finished report. And I'm sure it's going to inform the DOE also in terms of their recommendations. So Bill, you just launched a campaign, Hopeful Futures. You've brought together a large number of nonprofits and advocates with this campaign, and you were able to learn from Mary from some of her early insights into her policy report that's coming out. Can you talk about the campaign, what you're focusing on, what you're hoping to achieve?
Absolutely. So last month, along with 10 other organizations, we launched, we're calling it the Hopeful Futures Campaign, and it's hopefulfuturescampaign.us if you want to check it out, with a really big and bold goal to transform school mental health for every school in the country. And the report that that Mary just sort of gave you a preview on is hugely helpful here, because part of what we have to do is map what changes are needed where. And the approach that we're pursuing is called comprehensive school mental health systems, with the operative word being comprehensive. So it's not just screening, but it's tied to the tiered levels of services and supports and training for school personnel, more mental health professionals, age-appropriate curriculum, as Mary discussed. And this whole suite of policies, once it's in place in a school, it will promote, creates a positive school climate and make sure that children aren't slipping through the cracks. And so there's sort of three big strategies within the campaign that are related to all those things that Mary outlined. And the first one is funding, because we have to have enough funding in our schools to pay for access to services, appropriate personnel, and putting all these systems in place. The second is technical assistance, because this is complicated, right? There are lots of different moving parts to it, and we've got to make sure that we're giving people the tools for success there. And then the last piece is policy change. And a lot of that education policy is set at the local and state level. And there's some federal policy changes that we need that will make all of this easier, and certainly funding at the federal level. So that's why we've got to build a multi-tiered campaign to get this work done, and empower advocates. And we're excited to have youth focus groups like Bring Change to Mind and Active Minds engaged to help bring youth into that conversation, to advocate for those things that will set these systems up for success.
I mean, it's a lot, Bill. I mean, in a perfect world, you'd have the funding and the resources to be, in every single state. Of course, that's not possible. How are you prioritizing on the ground the work? If you could give a example of a state or two where you feel like there's a great opportunity.
So a couple of ways we're thinking about it. One is, you're right, there's only a certain number of states where we can run full-fledged campaigns that hire lobbyists and drive big communications efforts at a time. And so what we're doing is building out an activation platform that has a map where you can go and click on your state, find out what policies are in place, what policies are missing, advocacy tools to help you advocate for that. Because if we start in, say, 10 states, we don't want to tell 40 states they need to wait for this, because it's too important. And so we want to create sort of open source tools that all the different organizations, and frankly, organizations and people that aren't even a part of the campaign can use, so that we get that. We want to create a dull roar in state capitals in Washington so that we can create these changes. But some specific states, there's good stuff going on in Ohio right now, which is exciting because it's sort of a red state legislature. And then also in New Jersey, I was glad to see Amy Kennedy on the attendee list here, and is in conversation with the governor and the legislature there about a pretty big package of stuff. But one of the big things we've got to do over the summer is work with Mary and the National Center for School Mental Health and others who have been pulling all this data together to figure out exactly where we need to go, when, and why, and to do that strategically and methodically.
Yeah, not to stress you out, but quickly.
That's right.
Nia, from your perspective, what are the highest priorities around youth and mental health policy right now?
I'm going to try and thread a few things together with my answer to that question. So Bill alluded to young people who fall through the cracks. And I think a lot of our work on the youth policy team at CLASP is really focused on those young people who get pushed out of school, who are what's known as opportunity youth, young people who are not in school, not working. And so I want to preface what I'm going to say by saying that many of our recommendations and much of our policy focus actually seems like it's outside of school, because we're listening to those young people and recognizing that, first of all, school is not a safe place for everybody and is not the preferred source of services for everybody. So we want to make sure that we're not forgetting that as we think about our investments in school and think, oh, if we just get everything together in the schools, then we're done and we're good to go. But that said, we also sort of are of a mind, and this has particularly come through in a new deal for youth as well, that when we take care of the young people who are the most marginalized, who are the most disenfranchised, who are the most criminalized by our existing systems, that's actually better for everybody. So even though I'm going to start with a bunch of recommendations that seem like maybe they don't have anything to do with school, they actually are very closely connected to school, or can be very closely connected to school, to be more effective for all young people, no matter what their level of need. So in terms of overall priorities, a couple of the things that we're thinking about are going to echo what Mary talked about at the state level, and really trying to make sure that they're well resourced and supported at the federal level. So one area we're thinking about a lot is mobile crisis response services, particularly as the 988 number is rolled out. So for anybody who doesn't know, there was legislation passed last year that's going to make 988 the 911 of mental health and other types of crisis. And it's going to designate that number as a number that folks should call nationwide if they're experiencing some kind of trouble. But in order for that to work, there has to be somebody who can respond to those calls that is not law enforcement, and that has the proper training and is able to sort of de-escalate those situations and help and support young people and people more broadly in terms of what they need. So we've been, doing a lot of work to think about what does reimbursement by Medicaid need to look like in that space? Sort of what are the other, how do we build out those systems? There were some resources in the ARP to support the expansion of mobile response services across the country, but I think most people would argue nowhere near enough. So we're definitely paying a lot of attention to how those plans roll out, and particularly when you're thinking about young people of color, making sure that those services are independent of law enforcement. Because for young people of color, if law enforcement are involved, then that's going to either increase the trauma, increase the risk, or make sure that people of color just don't call the number. Another area that we're thinking a lot about is youth peer support. A lot of times when people think of mental health support, they think counselors, psychiatrists, psychologists, and all of that's fine. That's not necessarily young people's first preference all the time, or what they first name. And peer support is a really important resource that they name. These are fellow young people who have lived experience with mental health, with systems, with that kind of thing, who are trained and certified to provide support to other young people. And those folks, again, can be really instrumental in any setting. So we think about them as part of mobile response. We think of them as part of mental health systems. They can absolutely play a role in schools. And just it's about making that connection and making sure that that's a resource that's available to people in schools. The piece that Mary mentioned about telehealth, and the pandemic has really opened up a lot in terms of young people being able to have services that they always wanted actually get reimbursed. But a lot of those those things that have expanded access to telehealth are slated to sunset with the public health emergency. So we're really thinking about what we can do to make those changes permanent, and not only make them permanent, but very specifically think about text and app-based mental health services, which is something that is really important to young people as well. And again, has implications in a school setting to be able to expand what kinds of support young people can get and how easily they can get it. And then I'll finish by talking a little bit about what we've been thinking about in the school space specifically. Again, not really that different, but there are all these resources that are coming out right now that are being poured into schools for school reopening. And while mental health was named as an allowable use, it wasn't a required one. So we've been really working with the Department of Education, Department of Health and Human Services, to try and push for guidance to say to schools, yes, you need to get your PPE. Yes, you need to think about, your filtration systems and all those sorts of things. But equally, you need to think about young people's mental health and how you're going to deal with the fact that we as a nation have experienced a collective trauma that everybody has been impacted by in some way. How are we going to prepare our schools as young people come back into the building to be receptive and responsive to that? How are we going to prepare the adults in the building to deal with that appropriately? So we did do a sign-on letter a few months ago in partnership with the Kennedy Forum and some others, where we ended up getting close to 100 organizations to sign on, not just mental health folks, not just education folks, but also civil rights folks, also youth organizations, sort of with a real understanding that this is an issue that cuts across a lot of sectors, and where there's a growing understanding across sectors that this matters to all of us and we need to come together around this. And then the last thing I'll say is sort of what I said about the last question. As schools are developing these plans and thinking about what services and supports they want to bring into buildings, young people really need to be a key part of that process. So we've also been sort of pushing for, you know, the different agencies to think about how we can support and encourage schools to build the resources and the capacity for young people to meaningfully advise and lead those processes as schools are reopening.
Thanks for such a thorough response, Nia. A couple things. One is we totally align with your thinking about bringing in other funders and stakeholders, not just looking inside the tent of mental health and addiction funders, but going to adjacent field funders and talking to them about the importance of mental health and social emotional health with education funders, disaffected youth, poverty alleviation, because that's the only way we're really going to bring more philanthropic dollars into this sector is people that are perching on the edge of the nest, and we'd like to have them join us. I'm also really grateful for the work your organization is doing around 988 and mobile crisis for youth. The whole movement, the mental health movement, is really focused on 988 right now, and a lot of it is about adults, and they have different, you know, issues. They have the jails and the prisons, they have housing, they have air quotes, you know, a mental health system to operate in. But with the youth, we don't have that. It's very different. It's foster care, it's juvenile justice, it's schools, it's families. You have a workforce shortage issue. You don't use peers when you're working with children. You need more clinicians. So I'm glad that you're making a lot of noise about that, because at Mindful Philanthropy, we really want to lift up a youth focus within 988 response. So thank you for that. Will, from your perspective, what is most helpful for organizations to do to support youth?
I'll definitely say the number one thing is opportunities, but not just opportunities by themselves, in connection with support. Because when we find out through advisory boards that help Mary over there at Mental Health America and the New Deal for Youth with CLASS, the Center for Law and Social Policy, we see not just the opportunity for us to collaborate and build toolkits to engage other individuals or proposals for policies or whatnot, it's also those organizations' support to get behind us. And it may not even just be support from those organizations, but as well as from our community, from our family, to where we want to ask this legislature to get these things done. So we may need help calling this state representative or this state senator, or, you know, even to the federal level with that support right there. So we can obviously have the opportunities, but we also need you all support with it for the activists. And once we see things and changes and our solutions being implemented, then we'll continue on, because it's success that's happening. And young people, they have the vision for the upcoming future. So once they see their visions being implemented, they'll continue to be those activists well into their adulthood to lead society in a very efficient way. You're on mute, Barbara.
Thank you, Will. So let's do a quick lightning round, and then we'll shift to audience Q&A. I'd like to hear from each of you just what makes for an effective youth movement in mental health. Start with you, Bill.
I mean, I think it's very simple. We need to give them that, educate them on the policy piece, but empower them to then go and do it. And frankly, get out of the way, because one of the things in the advocacy world that I'm in, youth are constantly reinventing the strategy and the tactics about how to get the work done. And so they don't need us to necessarily tell them how to do it. What we need to agree on is these are the things we all want to get done. Then we need to empower them to do it, support them to do it, and frankly, get out of the way, because they know what to do. Youth are really fantastic organizers, and they're innovators.
Nia, how would you chime in?
I think this is really important, but often overlooked. It has to be resourced. You know, the change makers who are part of a New Deal for Youth are compensated for their time and for their expertise, just like we would compensate any other expert for their time and their expertise. That's really important, because, you know, we have people who are change makers who are parents, who are students, who are working, who have all these other kinds of roles in their lives. And it's because we're able to resource it that they are able to come to the table and continue to come to the table and continue to contribute in ways that they wouldn't be able to if those resources weren't there. And that also means for an organization like CLASP that again is sort of new to this kind of work, we got to change our financial systems. We got to make sure we can get people stipends paid on time. We got to make sure, we got to think about for our unbanked, for our undocumented young people, what does it look like to make sure that they're getting their stipends and that they're getting them in a timely fashion. So it really does require resources to do this work well. And I just want to make sure that, people really understand that because particularly if you want to have equity in who is able to contribute, is really, really important to make sure that you are compensating and supporting young people financially for their time and for their expertise.
Mary, your thoughts?
Well, I thought William put it really well on the, partnership that you want to have when you're empowering and having youth work in a movement. And I've seen that with some of our affiliates as well. And I think that's where we want to go with our next phase of the work is working with our affiliates. So one of our affiliates in Virginia, the youth leaders, as Bill said, they knew what to do. They went and took that legislation and they got a sponsor and they moved it. Our affiliate really highlighted their work, got more recognition to the work that they were doing, and elevating the youth as the ones doing it. And then also helped with the implementation because, once the bill is passed, coming back to the state officials over and over again, that was something that our affiliate could help with because the students were in school and, following up all the time with state officials wasn't really going to be as easy for them to do, although they were key and throughout the whole process. So I think partnerships and thinking about that so that it can, and helping organizations really think through how to have a true partnership where youth are in the lead, are empowered, and they're getting the information that they want when they want it. Because in Oregon, for example, the youth really found it useful to have preps when they were going to testify and have lobbyists from their partner, which was Providence Health, to kind of do those preps for them. So I think that there's a lot to learn and a lot to think about on how we can all partner together to support youth to really make incredible change in this area, which they're already doing.
And rounding out with you, Will, what makes for an effective youth movement in mental health?
Yeah, I'm definitely going to be echoing what everybody else said. One, education. It has to be catered to them, relatable to them, allow them to understand that it affects them. Once that's done, then the funded opportunities. Like Nia mentioned, we are given stipends. We are paid for our services that we're providing, whether we're consultants or serving on an advisory board or serving as interns. We're compensated as such from our previous experiences, the work that we're doing, the research, and the anecdotal incidences that we're seeing down on the ground in our areas. And then last but not least is motivation. Because once they have that education, they understand that it affects them, they're motivated to get on the ground running, whether that's starting their own organization, joining organizations, and then putting solutions down to the ground, whether that's getting a sponsor for a bill to have it pushed through and signed by the governor, or even all the way to the federal level. So education, funded opportunities, and motivation to get the job done.
That's great, thank you. And I'd like to switch to audience Q&A, and there's a good one here, and I'm gonna throw this one at you, Bill. So the elephant in the room is the American Rescue Plan includes $123 billion for K through 12 schools. This is happening in real time. We need to help shape where this funding is going. What is philanthropy's role in light of huge chunk of money coming down, but the need to use that money in the best possible way so we create a long-term comprehensive approach to mental health in schools? Where can philanthropy play?
There's just a huge role to play. And, one of the things Nia said, I like to say it's a lot of money, but I also like to be careful when we're talking about the federal money being a lot of money, because there's a lot of technical stuff we're going to have to do to get people educated around ways to use those rescue funds, including things like being a service center that can provide Medicaid services. If they would use some of those funds to do that, that could set school systems up for sort of permanent pipeline of funding. But all of this takes an enormous amount of organization and work. And I think today you've seen a pretty good example of, Mary and Nia are two sort of policy ninjas, and we need to fund the work that does that policy development and best practices and works with the government on all of the regulatory changes that we need. But private foundations, you know, people sometimes worry, say, oh, there are all these restrictions around direct lobbying, and there are, but they can support policy development, educating policymakers about specific issues, things like what you can do with rescue funds, provide public opinion research so we can show people that the public is with us on this. And you know, C3s can also raise non-private foundation funds that can do some of the direct lobbying services. There's some limits on that. And then, you know, C4s can fund unlimited amounts of lobbying and advocacy. You know, we set up Inseparable as a C3 and a C4 to have flexibility for how we work with Mary and Nia and other organizations in the space. But there's just so much that we can do if we can scale this work up, and there's just a big role for philanthropy in that.
Thanks, Bill. And Nia, you mentioned that also, just resources. People aren't supposed to just do all this work for free because it's the right thing to do. I mean, they need to put food on the table, and we need financial resources. I have a question here, and this goes to Nia, talking about 988 crisis coming to law in July of next year. What's the intersection between 988 and schools?
Sure. Just a quick note, I'm going to add Policy Ninja to my bio. Love that. I just came from a webinar that one of my colleagues did right before this, where we were profiling a couple of states that have done strong youth mobile crisis systems. And one of those places is Connecticut, where they actually have MOUs, Memoranda of Understanding, between their mobile crisis and their school systems. That was required by state law. And basically what it says is it lays out, these are the situations where you should call, the number there currently is 211, where you should call 211. And what it has done for them is it's reduced suspensions, expulsions, school-based arrests, all these sort of types of situations where in the past they might have called 911 and had law enforcement show up, or be putting kids in an ambulance to an emergency room because of a mental health situation. That situation can be de-escalated and the kid can return to class, you know, or they can just get whatever services and supports that they need so that, you know, they can continue to function, and we save all those hospital bills and we save the trauma of having law enforcement involvement. So sort of the connection there is that if we build the system in a way that we have really strong partnerships between schools and the mobile response system, that's going to have all kinds of benefits for schools and for the larger community. Because to Bill's point, there are a lot of, you know, most kids are in school most of the time. And that's a place where really a lot of these issues come to a head. And yes, you want to be able to have all the supports in place and, you know, have supports in-house at the school, but you also want to be able to have someone that you can call to provide that next level of services if things are escalating or if a situation's out of control. And how much better is it to be able to call mobile response to deal with those situations as opposed to calling 911? We've seen so many incidents just in the last year of times where 911 has been called for kids who are suicidal, who are experiencing trauma, who are just going through something with really, really bad results. And so there really is a place to think about how we build out this network of support across the whole community and build really strong partnerships to support kids inside the school building, outside the school building, wherever they are.
Yeah, way too many times I've heard from friends or acquaintances, my 11-year-old was having a break, you know, was a psychotic break or having a very bad episode, and all I could do was call 911 and they put my 11-year-old in handcuffs. Like, that's just, it's heartbreaking, and that's the path forward for so many states right now. So I'm glad to hear that about Connecticut. Mary, here's a tough one for you. A funder asks, what does it look like to implement comprehensive school mental health in practice? This all feels overwhelming.
So I think that what our report's going to highlight is that you can look across a series of policies, and there are assessment processes that schools and states can kind of use to guide them. So I agree with you, if you're starting from scratch, it might seem overwhelming, but there are some assessment tools that can be used to kind of look at where you're at and where you're going, whether you're at the school level or the state level. And then as you look at where your gaps are, there are some policies that we're trying to put forth and highlight that could be particularly helpful. And I always, you want to look at basic things like things that all students will benefit from. That's like mental health education, those kinds of things that are at the level of all students. And then each level from that. So how do you make sure then that students that are having issues are identified and then ultimately get services? So I think if you think about it that way, and you look at the way folks start with assessments, it breaks it down a little bit. I did go through a lot of material, and the report has a lot of material, but I think fundamentally, it's about making sure that everybody understands more about mental health in general, and then creates a climate that is supportive at each level for students.
Absolutely. We don't want the teachers to feel like they have to shoulder the burden alone. Ideally, you've got the bus driver, the coaches, the cafeteria worker, all in understanding what good mental health looks like and be ready to support in a way that's appropriate. I mean, it's really, when we look at a comprehensive approach to mental health in schools, it's the 1-2 punch, right? It's policy, and then it's also programming. Bill, I know with Hopeful Futures campaign, you are keeping programming in mind as well. How are you speaking about that with your constituents?
I mean, the good news is all of the different organizations in the campaign have really fantastic expertise around the different pieces, because as Mary's saying, there are a lot of pieces to this. So the Healthy Schools campaign folks are brilliant around FMAP and what we need to do to get Medicaid reimbursement for services. The JED Foundation offers technical assistance for school systems that are working to implement comprehensive systems. National Center for School Mental Health is kind of like the mothership for technical assistance on school mental health implementation. And so they're different organizations that bring different skills to the campaign, because we're going to need all of those things working in concert to put these systems in place.
Well, it's exciting. It really is a once-in-a-lifetime opportunity to get this right. And I just hope that the philanthropies that are on the call today feel really motivated to lean into this and see a way forward for their own giving here. Will, do you have any closing thoughts on the session and engaging youth in policy?
I'll definitely say with like the Hopeful Futures campaign, New Deal for You, Mental Health America's study that's coming out in July, and that great work that Mindful Philanthropy is doing and I'm a part of, is definitely needed and essential for youth getting into policy and making sure that we're focusing on their mental health as they begin to grow up and become the leaders of society. Is definitely needed. The work that's being done is amazing. It's addressing gaps and issues that have never been looked at before. And as a part of it comes from our expertise, our experience, letting you all know that, and then also you all doing the research and putting in the time to find those areas that need to be addressed. And you all are using the correct funds, as well as these philanthropy and foundations that are giving, is definitely appreciated and very helpful.
Well, I really appreciate all of you being here today to share your knowledge and expertise with our guests. And I look forward to seeing you a lot this summer. It's going to be very busy. I understand the DOE is going to be coming out with pretty substantive recommendations in July. Right, Nia and Mary and Bill, coming out soon?
Hopefully.
Hopefully. Well, I'm sure you're advising them. So what I'd like to do is we're going to share a survey in the chat. Oh, I think Allison just put it in there. Love to get your feedback. We are always learning at Mindful Philanthropy and trying to improve on what we offer to donors. And we will also be sending a follow-up email. The survey will be in that email link. And we'll also include a handful of shovel-ready, high-impact funding opportunities, which includes supporting CLASP and Inseparable and MHA. So I just want to thank all of you for joining us and have a great rest of your day.
Thanks, everyone.
Thank you.
Bye.